Afternoon, everybody. It's a pleasure to be back with you. It's Good Friday, a very, very good Friday indeed. I'm Daniella Levine Cava. I'm Commissioner District 8, Miami-Dade County, and we are with one of our Monday, Wednesday, Friday episodes on Our Community Cares, bringing you important information and resources in the coronavirus COVID-19 era. Today, we could not be more delighted to have two outstanding guests with us. We're moving into the medical arena. So up until now, we focused a lot on the economic issues, looking for new jobs, losing jobs, tenant rights, unemployment benefits, the issues with mental health, and so on. It's been really very diverse, and we commend you to look at our archive material on the Facebook page. But today we're shifting gears and we're going to learn specifically about the COVID virus itself. We are going to learn about the transmission and about treatment issues. We have an amazing expert, our very own president of the University of Miami, Dr. Julio Frenk, and with him, the chief medical officer for UHealth, and that is Dr. Dipen Parekh. So we're thrilled to have you both, and we're going to start by just getting a little bit of background on Dr. Frenk. So not only has Dr. Frenk been the president at University of Miami since 2015, and I remember very well the day that he arrived, to great excitement in our community. He is also a scholar and leader in the field of public health. So this is extremely valuable to us in general, but certainly in today's troubling times. He was the dean at the Harvard T.H. Chan School of Public Health. He was the Minister of Health in Mexico and led a reform of the healthcare system in Mexico. He also served with the World Health Organization and with the Gates Foundation. So he has an extensive background. He's dealt with other pandemics, and so he brings his wealth of experience to his current post. So let's just start with you, Dr. Frenk, if we could. If you could tell us some of your key takeaways from the prior experiences you've had managing pandemics.
Sure. Well, thank you very much, Commissioner. It's a great honor to participate in this opportunity to be in a dialogue with the citizens of our own community. At the University of Miami, we pride ourselves in being present at our community. We very much appreciate our belonging to this vibrant community in Miami-Dade, and I'm very grateful that you've invited me and Dr. Parekh to share some of our viewpoints. Yes, this is indeed my fourth pandemic or related public health emergency of international concern that I have had a direct role in some decision-making capacity. The main takeaway from the previous ones applies to this one, and that is that almost by definition, every time a new pathogen, what we call a novel pathogen, a new germ that causes a disease appears, by definition, the essential characteristic of the emergency is uncertainty. Even though we learn things from previous emergencies, we can't be 100% sure that this new one is going to behave the same way, because this is the first time that humans are encountering this particular germ. And so that requires two key elements. One is what we call contingency planning. And you need to be able to imagine every single possible scenario and be prepared, be ready for whatever comes your way. It's the old saying of prepare for the worst, and then we usually say and hope for the best. But in this case, it's not hoping for the best, it's working for the best. You want that worst case scenario to be a self-defeating prophecy. You want to work very hard to prove that you were wrong, that your predictions were wrong. And that's very important that we understand that. The second big tool is good communication. People faced with uncertainty need some communication to know what to expect, because we're learning as the epidemic evolves. And what you're doing as commissioner here in our county is very valuable, keeping citizens and their families and everyone, every resident informed about what's going on. That to me is the key takeaway. Having said that, I do have to say this is the magnitude of the impact of this particular pandemic is unlike anything I have seen before. It's been much more severe. The global reach has been larger than previous ones. But most importantly, this pandemic has had, this particular virus has had two characteristics that have made it particularly challenging. First one, it's very contagious. It's a respiratory disease, so usually respiratory diseases are easy to transmit from human to human through droplets. But this is very, very contagious, more than the influenza virus. And the second thing is that people that are apparently healthy, with very little symptoms or no symptoms at all, can actually transmit the disease. And that's why what explains why we've had to introduce what we're calling social distancing. I prefer to call them physical distancing measures. We don't need to be socially isolated. We can be connected through technology like we're doing now, but it's physical distancing. And that applies to everyone, whether you feel sick or not. Everyone needs to stay at home. Everyone needs to follow that, because even people who think they're healthy, who feel okay, can actually be infected and transmit the infections to others, and then put people like older people, people with underlying medical conditions at risk. And that's what's requiring a huge sacrifice on the part of everything. But let me reassure everyone that those sacrifices will be worth, there will be a reward, and that is a reward in less deaths, less suffering, and a reward in that we're going to come out of this at a much quicker than if we just let things follow their natural course.
Well, thank you so much, President. What a great overview of the situation, and to know that you have so much experience, but you know how this one is unique. And I would like to ask you, how do you think we might be responding here locally at the community level different from other places, or how should we be responding differently from other places?
Well, I think Miami-Dade has been responding well. The big issue nationally and internationally, this has not just been the US, has been the initial delay in testing. And because it's a new pathogen, because the tests are complex, we just started testing late, and that gave enough time for the virus to become entrenched in the communities. And that's when we have had to move to this sort of social distancing and isolation techniques. We are catching up, but that's been the issue. After that, I think we've introduced the measures. Now, for us as a university, we are doing three things. First of all, like every organization, we're keeping our own community, our students. We have 17,000 students and 18,000 employees, so 35,000 people safe. We've partially closed the campus. We left a few number of students who literally had no place to go but their dorms. These were mostly international students, but we more or less shut. And very importantly, we migrated, like almost every other universities and the school system, we migrated quickly to an online platform, and every course now is there, and we have kept the continuity of our educational mission. But we also have a very important role, which is that we are the only academic health system in South Florida. That is UHealth. And in a minute, I'll ask Dr. Parekh, if you allow me, just to say a little bit of how we are getting ready, because we are there on the front lines of taking care of not just of the people who work or the students who study, but our entire community through UHealth. The third role we play, of course, is we do research. And we have researchers really at the cutting edge of innovation, putting out new tests so that we can actually get better at that, doing the clinical trials for new medicines, and working on a vaccine, which is going to be the ultimate solution. But I think a key part for those who are listening is to understand how our academic health system, our hospitals in UHealth are responding. And if you allow me, Commissioner,
absolutely,
who's the Chief Operating Officer and a very, very distinguished clinician, is leading that effort, and he can tell us a little bit of how we're getting ready for the surge in demand that we are expecting will happen.
Excellent. Let's turn to Dr. Parekh. Thank you so very much for being with us, Dr. Parekh, and very eager to hear about the academic and health systems part of the university's response.
Thank you, Commissioner Kawa. Thank you, President Frenk. So first of all, I appreciate the the chance to participate in this show. As President Frenk pointed out, we are the only academic center that takes care of tertiary quaternary cases. The University of Miami Health System, along with its partners, the Jackson Memorial Health System, and we have been prepared for this, or have been preparing for this from the second week of January. So in that regard, we have been far ahead of the game. Right from the time a COVID positive patient or a presumed COVID positive patient enters our health system, there's a separate screening tent and facility outside our emergency room. So these patients will never contaminate the other patients that are seeking care in the emergency room. These patients are screened by our staff and our healthcare workers. By the way, the number one priority for our entire health system has been the safety and well-being and welfare of our staff and healthcare givers, because if they have a safe environment and they feel safe, they will be able to provide the best care to the community. Once these patients come in and they are screened, even if there's a suspicion that they are COVID positive and they are tested, there's a completely different transport system within the hospital, including separate elevators. They are all located into a separate floor with negative pressure air, where some of these COVID organisms will not be able to transmit with all full precautions. So they are completely vertically isolated in a separate area in the hospital, where all the caregivers have full access to the PPE or the personal protection equipment. More than the access, we also have complete thorough education of healthcare givers, because it's a very cumbersome process to go into that gear. It takes about 10 to 15 minutes. And if you don't do it accurately, then the whole purpose is lost. So we have been doing a very thorough education of the healthcare workers, complete separate isolation. Our doctors, our ICU care doctors, critical care doctors, and nurses are providing stellar protocols and delivering care to these patients. It's not a random way of taking care of these patients. It's very by the book, protocol oriented. There's a stepwise approach about the patients who need more intensive treatment or some of the newer treatments that may or may not be tested. We are doing 2 or 3 active clinical trials, including a stem cell trial and a trial where we give the plasma or the serum of a recovered patient to a COVID patient with the antibodies to take care of these patients. So,
thank you. Exciting. What a broad range of things that you're working on. I did not know about all of those things. As far as taking the stem cells, we have, of course, our City of Miami mayor, who famously went through the recovery period, was first infected, and I understand he has donated his blood for purposes. Is that part of your study?
I'm not aware. I can't. By law, we can't disclose
Well, he disclosed.
But I genuinely don't know the answer to that. But I will tell you just one very important piece of information. If you look at the mortality rates of COVID-19 across the country, and even if you look at the mortality rates in Florida, our mortality rates in our hospital so far has been 50% less compared to any of our peers or anywhere else in the country. And that's a lot of kudos to our wonderful healthcare workers.
Thank you. Thank you for sharing. And, I'm on daily briefings with Mayor Jimenez and senior staff, and Carlos Magoya is on, and he reports, across the system, the status of the availability of the hospital rooms, the ICU, the ventilators, and so on. And yes, we are very aware that our mortality rate is lower than other places. And so thank you for helping us to understand some of the reasons why that would be the case. And of course, the extensive research that you're doing. And on Monday, we have Dr. Erin Kobetz coming on the show to talk with us about the public health study to look at the incidence in the community by a randomized sampling of tests.
And as President Frenk pointed out, we are also planning very actively for the surge that is incumbent upon us. We are very prepared for the surge in terms of scaling our operations. If need be, we can convert our entire hospital into a COVID positive hospital and do more. We have 6 phases of activation, from phase 1 to phase 6, where with each phase, with the surge happening, we have an incremental increase in our capacity that triggers the next phase, and we can go up to 6 phases in terms of ramping up very quickly. We have a wonderful initiative of cross-covering and taking care of our workforce and our personnel, because 20 to 30% of workforce could be lost
Yeah.
by getting infected. So we have that going on in a massive scale as well. But we are
Thank
ready
you.
for the surge.
And I'm very happy that you point out, and everyone needs to recognize that our healthcare workers are our #1 priority, because as you say, without them, we can't take care of this epidemic. And so all of the extra measures that you're taking are so critical. And also there was a discussion about furlough of hospital workers in the Jackson system, and fortunately that was avoided. We believe that even those who are not currently engaged in the COVID situation can be retrained, repurposed, and not a good time to be letting anyone off. And I assume the same is true for the UHealth personnel. You're not experiencing any need to furlough people because of revenue loss or anything like that?
Absolutely not, but I should let President Frenk talk about that.
Very
Yeah,
good.
no, we're very aware that right now, the frontline health workers and the support staff are truly the heroes here. And we're not going to be discussing those measures. Clearly, our finances will be very much impacted by this. As a university, we're losing revenue on tuition, on room and board. We reimbursed all the room and board for all the students that are not on campus on a prorated basis. But clearly, the cancellation of all elective procedures is going to have a major impact. But I think, that's a second phase. We are right now focused on delivering the best care for our community. You mentioned Dr. Erin Kovets. This is the first in the nation community-based prevalence study. And this is key as we plan to return to work. We're going to measure how many people actually now have the antibodies and could safely start. We start the economy gradually by looking at how many people actually have been infected, even if they didn't know it, and can go back. So that's our focus, the research and particularly the patient care. We will obviously we need to be already, we're in active planning about how we're going to respond to the economic emergency that starts behind the public health emergency and will last longer than the public health emergency. But right now, when South Florida and the whole state of Florida is bracing for the surge in demand that we've seen in other parts of the country, right now our entire focus is on being ready, as Dr. Parekh was saying, and we are ready to meet that additional demand with the highest standard of care.
Thank you so much, President, for your leadership on so many aspects of this. And just to go back to the everyday role that we play in the community who are not the healthcare experts. Obviously, we've been tightening down, safer at home, now wearing facial coverings. All of these are new orders coming out of the county mayor's office, and many of the cities have passed their own restrictions. Can you tell us why these are important, and if you think we've gone far enough? How long, should we heed the order? Do you see people not heeding the order? What are your thoughts about this as from a public health perspective?
Yes, this is crucial, and it derives from the characteristics of the virus that I was explaining before. What happens is this is not just a very contagious virus, but it has these characteristics. If people who may remember SARS, this was in 2002 and 3. SARS is another coronavirus, but it's only transmitted by people who are already very sick. So those people are already in the hospital. They're not out in the community. The problem with this new strain of the coronavirus that's causing COVID-19 is that it can be transmitted by people with no symptoms or very mild symptoms. And that's what's made this so challenging. And that's why everyone needs to understand that truly we are in this together. We all have our part to play. It's not just up to the doctors and the nurses and the researchers who are looking for tests and drugs and vaccines. Every one of us has to put our part, because the key here is that by staying at home, by observing thorough hand hygiene, by covering our cough, by making sure we disinfect surfaces, by keeping social distancing about at least 6 feet from each other, by covering our mouth, which is not so much to protect ourselves, it's to protect others. Because if we are infected but we don't have symptoms because maybe we're young, but we can go and spread it to loved ones. So that's why we need to cover our face, to cover our sneezes or coughs, and observe this hygiene and this social distancing or physical distancing, including staying at home. All of that, which I understand is a big sacrifice for families. But there's a reward. The reward is that less people are going to get sick and less people are going to die from this.
Right.
But it's because of the nature of the virus demands this drastic action.
And I know it's early to be thinking about the future. We're dealing with the present. We haven't reached the apex of the infection rate here in our community. But what are some takeaways for us, do you think, as we think about the future? Because we know pandemics, you've already lived through 4. We know that these are not going away. So what takeaway lessons are there for our community going forward?
Sure. I mean, the first is, let's not lower our guard earlier. We're seeing that this social or physical distancing and stay-at-home measures are actually working. The curve is being flattened. It's not growing as much as we were fearing. The models that we used to predict or forecast the evolution of the pandemic are being revised and are getting better, more optimistic. This is because those measures are working, and we should take comfort in knowing that the sacrifice we're doing is already showing results. So we should not lower our guard, because if we relax those measures prematurely, we can have a second wave. We just saw that in Singapore. They've had a second wave, and we don't want that happening. Once we are safe and we need to follow the guidance from the CDC, then some of those ideas of gradually reopen the economy, because we all understand that people are losing their jobs. We need to quickly try to reactivate, but in a way that doesn't put the public health emergency, that doesn't reignite the public health emergency, because that would only set us back even in terms of jobs lost. So that has to be very carefully orchestrated. And that's why, this work we're doing with testing, this is a different test. This is not a test to see if the person has the virus, but whether the person has the antibodies, which means that they already got sick. And therefore, those individuals could gradually, and with social distancing measures and stringent hygiene and covering faces, we might be able to start reopening parts of the economy. That's as we go forward. But the two parts of this, which is dealing with the public health strategy and the public health emergency, and dealing with the economic emergency, have to go hand in hand with each other. And my takeaway is, once the emergency is over, we can't just go back to where things were before. We need to keep up the effort of investing in good epidemiologic surveillance and in preparedness, because there will be, unfortunately, future pandemics. And we will have other emergencies in South Florida. We know we always have to be ready for hurricanes. We now need to add our preparedness and readiness to face future pandemics as well.
Very good, thank you. Well, this is the last question that I have, and because we are not actually on Facebook Live because of technical difficulties, we haven't gotten questions from the audience. I'm so sorry about that. But if there are questions that come after, we will certainly forward them to you. Let me just ask, finally, as we look ahead to the hopeful cure of this situation, are there any words of advice or wisdom that you can offer the community or the healthcare providers from your vantage point? And then we'll also ask Dr. Parekh.
Sure. I mean, while this emergency is ongoing and we're all making sacrifices, there are some very encouraging signs. The level of cooperation of scientists across the world is unprecedented. It's up to the magnitude of this unprecedented challenge. And we're seeing, scientists from all over the world, including our own scientists at the University of Miami, leaving aside any issue of primacy in discovering something. We're seeing companies coming in, not worrying about intellectual property and who owns what, just everyone really pulling together so that we can find the 3 big tools we have: better diagnostic and screening tests, better tests, drugs that even if they don't cure the disease, can greatly improve the outcome, especially in the most critically ill patients, and avoid a death, and also relieve the pressure on the health system. And then ultimately a vaccine, which is the last one that will come online, that will be the ultimate solution for this challenge. So I am very optimistic. If we mobilize the tools of science, we will win this war. But this will require global cooperation. This is not a time of thinking that if we isolate ourselves, somehow we will be immune to these pandemics. That is not true. We live in an interconnected world. That's a reality that has produced a lot of benefits. And one of those benefits is that we can engage in active cooperation and it's only global solutions that will allow us to deal with global challenges like pandemics. And we see that on the part of our scientists and our doctors and nurses. Everyone is sharing experiences. The doctors from places that were affected first are actively sharing what happened, what they learned, so that those of us who are coming a little bit later are better prepared. And I think we have had a marvelous example of that kind of cooperation. And also from the citizens. The extent to which the stay-at-home measures, which we understand are very hard on people and families, have been followed, is just a testament to the level of community coherence when we're facing such a challenge. And I think that should lift our spirits, and we should applaud what everyone, both the frontline health workers, the scientists who are going to give us the ultimate solutions to this crisis, but also each one of us putting our own grain of salt. We're all acting together to face this challenge of a generation.
Well, those are very uplifting and hopeful words. I appreciate that very, very much. And before we close out, Dr. Parekh, do you have some closing remarks?
Sure, thank you so much. I'll close with my remarks being an ounce of prevention is better than a pound of cure. President Frenk spoke beautifully about the testing, about the drugs, and about the vaccines, but let's do something where we don't even have to go there. As a community, if we practice the simple steps of hand washing, hand hygiene, social or physical distancing, just basic simple facts, and change some of these things in our lifestyle, all of us will be so much better served for that.
Thank you. Thank you so very much to both of you. This has been really a very heartwarming discussion, I must say, in the face of the largest catastrophe that any of us have ever experienced. And you really make it clear that it's individual responsibility, which has really demonstrated itself to be in very high, at a very high standard. People are really stepping up. But coupled with the incredible scientific innovation and cooperation across the world that is going to lift us out of this dilemma. And I love President Frenk's quote, "Prepare for the worst, but work for the best." So that is definitely more than hoping. We are working together, each of us in our own way. So gentlemen, thank you so very, very much. And I think it's going to be great to go into the Easter weekend. And of course, it's still Passover, and we're hoping that the plague passes over all our homes in this Passover week, and that Easter will be filled with the joy of the holiday, even as people celebrate in a remote way. As you say, President, physical distancing, but social cohesion. We don't have to be separate, and people are learning lots of ways to do that. On Monday, we will welcome Dr. Erin Kobetz. As was discussed here today, she's leading the effort to do our surveillance testing across the community. And it's very exciting. It's the first in the nation. Dr. Fauci was the one to say that this would be important. And of course, here we are at the cutting edge in Miami-Dade County going forward with this blood test to check the existence of antibodies in the population at large, which should help us very much. So happy weekend, everybody. Enjoy the sunshine at a physical distance, and be safe, be strong, be kind. We'll see you next week.
Thank you, Commissioner.
Thank you so much.
Thank you.